Hello, I'm Dr. Sanjay Panicker. I started Amrita Homeopathy in 1997 in Kerala. It's almost 18 to 19 years since we started the clinic, and this is our first clinic in Bangalore on Koromangala 80 feet road, 4th block. Breastfeeding builds a very tranquil bond between the mother and the child. It's a very intimate bonding. Those are moments when the mother bonds with the child, when she feeds her child. It is a very well-known fact that children who are breastfed have better immunity levels. Now there is a lot of hypothesis on how this happens. They say that when the child is feeding on the nipples of the mother, the saliva of the child passes through the small ducts in the nipples through a phenomenon called as backwash, and the saliva of the child mixes with the milk of the mother, and this particular combination the body of the mother recognizes and produces a lot of immune cells which protects the child in turn when the child sucks on the breast milk. So there is a made to order kind of immune factors which are released into the mother's milk when the child feeds on the breast milk, and thus the immunity of the child builds up in the process of feeding on the mother's milk. If the child has any infection, it is said that the saliva quality also changes, and thus the mother's immune system identifies this particular change which has happened in the saliva and specifically produces immune cells which can attack those particular infectious organisms in the baby's body and thus protect the child. So the question of whether the child's saliva can cause an infection in the mother is very remote. The chances of that happening is usually not there. It's actually the other way around, that the mother is the protector of the child, and in fact the immune system of the mother is going to protect the child. So it's not going to happen the other way around.